we know that depression has really hit hard in this country throughout the decades, but more especially throughout this past year and a half. But there's a new study by Big Pharma that is pretty interesting. They're saying that a little laughing gas can help treat depression. So a dose of laughing gas may just help some people with hard to treat depression, suggests a new small clinical trial that was published this week. The study found that people who inhaled nitrous oxide reported improvements in their depression symptoms afterwards. It also found that people felt similar improvements with a smaller dose as they did with the larger one, but experienced substantially fewer side effects. For those who are not really chemistry inclined, nitrous oxide, or N2O, it's colorless, non-flammable gas at room temperature. It's always been used as an anesthetic, sometimes as a recreational drug, due to the euphoria and the hallucinations that it can cause upon inhalation. But several years ago, a researcher and trauma anesthesiologist at the University of Chicago and his colleagues began looking into nitrous oxide as a potential treatment for depression. Quote, it started with the observation that ketamine, a different anesthetic with similar mechanistic properties like nitrous oxide, was found to be a rapid antidepressant that also worked in patients with treatment-resistant depression. By connecting the dots, we hypothesized that nitrous oxide may also be an antidepressant. Now, the early research, which is truly early research, suggested that inhaling an hour's worth of nitrous oxide mixed with 50% concentration of oxygen could have rapid and marked antidepressant effects in patients with treatment-resistant depression. Cortez, you think that this could actually fly? Could this be an option for people?
Well, comedians been saying it for years. They like laughter is the best medicine.
Hey, there you go.
Yeah, every comedian I hear, and they do stand up and interviews. That's what they believe, and it's true now. I feel as though if you are dealing with long-term depression, like 17 years, that's a lot of years of being depressed. I mean, that's more like chemical depression at that point because it's an imbalance, a chemical imbalance. But if you are that cat that's having some hard times and you just get depressed, you can always, we encourage everybody, go see a professional, go see a counselor if you are dealing with bouts of depression. Don't go by what your friends tell you. Go out and get some help. Yeah. But yeah, I think this is if it makes people feel better, man, about themselves and get that depression monkey off their back. I think this is a good way. This is a good direction for it to go. Yeah, I'm all for it.
Yeah, definitely. GPS. They're saying possibly that these effects could last possibly at least a month. Thankfully,
the effects of the treatment, you mean?
Yes, the effects of the treatment could last about a month. So who knows? You can have people just popping in and saying, hey, look, just give me an hour's worth of laughing gas and I'm good for the month. Shit, I'm ready to go get a tank right now. Just put it inside the closet for a rainy day.
It's just the problem is, that's the thing, man. If that person has a chemical imbalance, it's only a temporary fix. They're going to have to constantly keep going to get refills.
True.
That's the problem, man. You want something, and maybe that may, at this point, we haven't got to that part in science where we can actually cure it. But yeah, I mean, that's something, that's definitely a better alternative compared to still being depressed. And yeah, some guys, they may not want to do the medicines, man. They may not want to do the medications.
Yeah, and that's the thing, GPS, because I think a lot of people are over medicated just in this country. I mean, if you look at the commercials on TV, it's like, okay, I got a medication for this issue. I got a medication for this issue. It's like we're too drugged up to really just try to be normal. So what do you think with this laughing gas testing?
If you can make if you can find a new use for something that's already here, then why not? But, this is not a normal world that we live in anymore. I mean, I can remember the first recession that we've all experienced, as adults, really, back in 2007, 2008. since then they've only gotten worse.
Yeah.
And this one right here really put people back. People have been found work for a year, almost even two, because it's you have such abnormal circumstances. You need something, and people aren't necessarily turning to exercise, or they're not seeking any spiritual guidance. And, they're just looking for the next maybe physical thing they can find, and it's not there. So now you need something, medicine.
I still say it's a plus. I say this is something that maybe should be looked at. Maybe this is something that could curb our addictions to medicines that we have here. This is something, in a sense, it's more natural. This is something, it's on the periodic table. This is something that you can create, not in a lab, not waiting 6 months to a year. It's available whenever you need it. If they find a way where they can make something like a little temporary monthly thing, or everybody's got an inhaler if they have asthma. Hey, make an inhaler that has laughing gas. Possible.
Yeah. Also, I still encourage them, if they're going to do that, still see a counselor, just to talk out your underlying issues.
Definitely.
Because that's the protocol is. They give you meds, and then you still have to go to your sessions. And those seem to be working, but yeah, I'm all for getting everybody off meds, definitely.